Hey guys, so I am about to go in to see my doctor to talk to the fertility specialist. So wish me luck. I'll do a video once I'm out. Hey guys, so I'm doing blood testing right now. Waiting. I have lots to tell you. I had my doctor appointment today and all went pretty good, I feel. Hold on one second. Okay. Whoops. I feel pretty good about what the doctor said. I met with her and she's super nice, and she basically kind of explained everything to me, what PCOS is, so I now have a really good explanation of what it is and what I have. And she kind of went over everything in my health history, and I definitely have some things I need to do before I can start treatments, and she wants to get me on Clomid and another one that I can't remember the name of. But yeah, so it was good, and I feel really good about it and excited. And I went and got my blood work done. That was one of the things I had to do. She needs to check my glucose levels because women with PCOS have big chances of getting type 2 diabetes. So she wants to check on that. And so I have another thing that I have to do that I'm really dreading, and I'm really nervous because I've heard that this procedure is quite painful. I don't know if anyone else has gotten it done and you had a good experience. It's the HSG test. Basically, they inject through my uterus. They stick like a catheter type tube up my uterus, and they have to inject it with dye. And the dye basically goes into my uterus. Somehow it cleans out my uterus, I think. And the dye goes up into my fallopian tubes, to my ovaries, and they put me underneath an x-ray, I believe. And they check and see if my fallopian tubes are not closed and that they're totally, there's no blockage or anything. So that's one of the big things I have to do. And since I'm in the very beginning of my cycle right now, I started my period on the 16th. I'm on my last day today. The doctor even told me, sorry, I cannot get comfortable right now. The doctor told me that since I just started my new cycle, to try and get in ASAP to get this HSG test and do the blood test, which I just did. And get both of those things done right away so she can get the results of that, and I can start the Clomid and all these other drugs that are hopefully gonna help me get pregnant. So yeah, it was good. And I called this place to schedule the HSG, but they haven't called me back, so I'm hoping they call me back soon and get me in ASAP, even though I'm so scared because I heard online that this procedure is quite painful. You get severe cramping. Not fun. But I mean, I feel like everyone has a bad experience with something, so I shouldn't read too much into it and just see how I do. The doctor told me to take Motrin or ibuprofen before. She said you will get crampy. And then I'm probably going to take like a Xanax or something just to chill me out because I get so scared during those kind of procedures. So yes, I have to get that done, got my blood test done, and then after that she's going to start putting me on stuff. So we shall see. When I was in the doctor's today with her, she wanted to do a vaginal ultrasound today. She wanted to just look at everything, get to know my uterus, get to know my ovaries on her own. Even though I got one done a few weeks ago, she wanted to do one herself just to see with her own eyes. And she said that my uterus looked really good and I had no fibroids, nothing. It was a good, clean uterus. Always good news. And she said that definitely she looked at my ovaries, and it was so crazy because I could see, she pointed the screen towards me so I could see it all right in front of me. I could see my ovaries, and she told me that I ovulated last month. I don't know how these doctors know this. It's so crazy. But she could look at it and she saw that I had ovulated last month. So she's like, that's a good sign. So hopefully maybe I'm ovulating a little bit more than some PCOS ladies. But anyways, yeah, she looked at my ovaries and she said that I had, my right one had like about 15, maybe a little bit more than 15, and my left one had like 25 cysts. Cysts meaning follicles. So basically the follicles are the things that the egg is in. So I have a lot of them and they're just kind of sitting there because I'm not producing enough progesterone to release those eggs. So they just sit in there, and that's what PCOS is. So yeah, she explained everything to me. It was great. I got a lot of answers, a lot of questions answered. I feel really good about it and excited. And I have a whole regimen of things I have to take. She told me to get rid of my other prenatal vitamins and take this Vita Pearl prenatal multivitamin with DHA. It's a prescription multivitamin, so I have to call this in every month and I guess they'll send me a month's supply every month. So I have to take those. I have to take folic acid, two of these 2 times a day. This is something I guess I really need. Aspirin. I have to take 1 of these a day, 81 milligrams of aspirin, low dose. I think it has something to do with thinning the blood, something. She didn't really explain to me too much why I have to take that. And then omega-3s, fish oil. I already have my own good stuff. It has omega-3, omega-6, omega-7, omega-9. It's called liver oil. It's a super, super good blend. So I'm going to take this, I think, 2 times a day. So that's what I'll be taking for now. And yeah, once I'm done with all the testing, doing my HSG, they want me to call them, and hopefully it's done this week so they can start me right away on this Clomid and get me ovulating. And hopefully, she said, we'll try seeing if you can get pregnant naturally on your own for a few months. Some women like to do it for a year. It depends on how impatient you are. We can do IUIs, she said. My husband leaves out of town a lot, and sometimes I miss the ovulation because he's gone. So she gave me the idea of having my husband give samples of sperm, so that way they have it, and if he's gone and I'm ovulating, I could just go in there and they can do an IUI, which is where they inject his semen up inside my uterus, and they know exactly when I'm ovulating. So that's a good little thing to fall back on in case he leaves. But yeah, it's great now that I have some help with someone that totally knows my whole situation, and she was the nicest doctor, and she really, really made me feel good about it, and she knows I'll be able to have a baby. She's like, you'll be able to get pregnant just fine, you're healthy, you'll be totally fine. So she really, really, really got my spirits up, and yeah, it was a good appointment. So my next steps are getting this dang HSG thing over with. I'm so nervous about it. I don't know if any of you that are watching, if you've gotten that done, please, please, please send me a message down below. I need to know, was it a good experience? But I mean, something comforting, because I've read so much on it and it sounds horrific, and I'm so bad with pain, and I know I need to get used to pain, because if I'm going to be having to give myself injections and stuff, I gotta just go through the pain. So I just need to keep thinking, baby, I get a baby from this. So yeah, speaking of babies, I have to show you guys something. Speaking of babies, so I like to antique shop, and there's this really cool antique place down the street from my house. And yesterday I got kind of bored and I went and I was walking around looking at stuff, and they always have cute little baby sections with like vintage baby clothes and vintage just like strollers and really, really cute things. And they had this whole rack of baby dresses, and I went just to kind of look through it, and I saw something that I had to have. I had to have this because it's so cute. I mean, it definitely would fit like a 1-year-old, but isn't it so cute? It's like a little fiesta, like Spanish little dress. I had to have it. I had to have it. It spoke to me, and I had to have it. So, yeah, I don't know. I just have a feeling that if I have a baby, when I have a baby, I feel like it's going to be a girl first. I've had a lot of people tell me, and my sister-in-law's sister was the one I told you guys in the last video. She told me that it's going to be a girl. So I've bought a few other things. I'll have to show you guys sometime the things that I've bought throughout the years that I've seen, and I'm like, I have to have this in case one day, you know. So I have a little box of things that I hold, of things that I just thought were too cute to pass up. So this is getting added to that little box of things. So anyways, guys, that's about it. Definitely so happy with this appointment, and I'm so happy to be on a plan now, and all is going to be okay, and I know I'm going to get pregnant, and it might not be during the time that I want it to be, and she even stressed to me, you cannot stress out, you cannot focus on it too much, because it just doesn't help. The stress doesn't help. So, and she's like, you want it to be an enjoyable experience for your husband too. You don't want him to be like, okay, honey, I'm ovulating, let's go have sex. Like, it doesn't have to be that way. You can do it in a better way than that. So, yeah, just, it's going to happen. I know it will. And she really assured me that she really can help me. So, it's going to be okay. I know it will be. And I'm so happy that you guys are here watching my videos. I know I'm new still, and I'm getting quite a few subscribers. So I really appreciate you guys coming on here and watching my videos and joining me on this journey. It really is. I feel like it's going to be a journey. So thank you for coming and watching and listening to me, and hopefully getting something out of it. You know, if any of you out there are trying, I hope that, you know, this is helping in any way. But yeah, thanks guys. Thanks for listening. So I will do another video soon, hopefully after I do that HSG thing. And I'm hoping that's going to be this week. So I'll let you guys know how that goes, and any other news that comes up, I will let you guys know. So I hope you guys are having a good week, and I'll talk to you guys soon. Bye.